Hey there, welcome to an exciting journey into biostatistics. Today, we're diving into a field that blends biology and math to uncover life-changing insights. Whether you're a student, a researcher, or just curious, by the end of this video, you'll see why biostatistics is the backbone of medical research, public health, and more. We'll cover what biostatistics is, its key concepts, real-world applications, and even a quick demo of statistical tools. So, grab a notebook, and let's unlock the secrets hidden in data. First, let's answer, what exactly is biostatistics, and why should you care? Biostatistics is the science of collecting, analyzing, and interpreting data to solve biological and health-related problems. Think of it as a bridge between raw data and meaningful conclusions. For example, when researchers test a new vaccine, biostatistics helps them determine if it's effective or just a fluke. It's not just numbers, it's about saving lives. At its core, biostatistics uses tools like probability, hypothesis testing, and regression to make sense of complex data. It's what tells us if a drug works, how diseases spread, or even how lifestyle impacts health. Let's break down some key concepts you'll encounter in biostatistics. Don't worry, we'll keep it simple and visual. Descriptive statistics. This is about summarizing data. Think averages, medians, or ranges. Imagine you're studying heart rates in a group of athletes. Descriptive stats give you a snapshot, like their average heart rate is 60 beats per minute. Inferential statistics. This is where the magic happens. Inferential stats let us make predictions or draw conclusions about a larger population based on a sample. For instance, if a study shows a drug lowers blood pressure in 100 patients, inferential stats help us estimate its effect on millions. P-values and hypothesis testing. Ever heard of statistically significant? That's where p-values come in. They tell us if our results are likely due to chance. A p-value below 0.05. That's a green light for confidence in our findings. Regression analysis. This helps us understand relationships between variables. For example, does smoking increase the risk of lung cancer? Regression quantifies that link. So, where do we see biostatistics in action? Everywhere. Let's explore a few examples. Clinical trials. When a new drug hits the market, biostatistics ensures it's safe and effective. It's how we know a COVID vaccine works, through rigorous statistical analysis of trial data. Epidemiology. Biostatistics tracks disease spread, like during the COVID-19 pandemic. It helped model infection rates and guide public health policies. Genomics. In genetics, biostatistics decodes DNA data to uncover links to diseases like cancer or Alzheimer's. These examples show how biostatistics turns data into decisions that save lives and shape health policies. Let's get hands-on. I'm going to show you how to run a basic statistical test using free software like our. Don't worry if you're new to this, it's easier than it looks. Here, we're comparing cholesterol levels between two groups. See that p-value? It's 0.03, meaning our results are statistically significant. This is the kind of analysis biostatisticians do every day. Let's test your knowledge about biostatistics with some questions. Question 1. A researcher is studying the effect of a new drug on blood pressure. They measure the blood pressure of 50 patients before and after treatment. Which statistical method is most appropriate to summarize the average change in blood pressure? A. Regression analysis. B. T-test. C. Descriptive statistics. D. Hypothesis testing. Correct answer is C. Descriptive statistics. Descriptive statistics, such as calculating the mean or median, are used to summarize data, like the average change in blood pressure. B. T-test or D. Hypothesis testing would be used to compare groups or test significance, while A. Regression analysis examines relationships between variables. The video emphasizes descriptive statistics as the tool for summarizing data, such as averages. Question 2. In a clinical trial, a p-value of 0.03 is reported for the difference in outcomes between a treatment and placebo group. What does this p-value indicate? A. There is a 3% chance the treatment is effective. B. The results are statistically significant at the 0.05 level. C. The treatment has a 97% chance of working. D. The null hypothesis is true. Correct answer is B. The results are statistically significant at the 0.05 level. A p-value of 0.03 indicates that there is a 3% probability of observing the results, or more extreme, by chance if the null hypothesis is true. Since 0.03 is less than 0.05, the results are statistically significant at the 0.05 level. The video explains that a p-value below 0.05 suggests confidence in rejecting the null hypothesis. Options A and C misinterpret probability, and D is incorrect as a low p-value suggests rejecting the null. Question 3. A study investigates whether a new vaccine reduces infection rates. The researchers used data from a sample of 1,000 patients to estimate the vaccine's effect in the general population. Which branch of statistics is primarily used? A. Descriptive statistics. B. Inferential statistics. C. Regression analysis. D. Bayesian statistics. Correct answer is B. Inferential statistics. Because inferential statistics allows researchers to draw conclusions about a larger population based on a sample, as described in the video when discussing how biostatistics estimates effects for millions from smaller studies. A. Descriptive statistics only summarizes the sample data. C. Regression analysis is a specific tool within inferential statistics. And D. Bayesian statistics is not mentioned in the context of this study. Question 4. A biostatistician is analyzing the relationship between smoking and lung cancer risk. Which statistical method is most appropriate to quantify this relationship? A. T-test. B. ANOVA. C. Regression analysis. D. Chi-square test. Correct answer is C. Regression analysis. Because regression analysis is used to quantify relationships between variables, such as smoking and lung cancer risk, as highlighted in the video section on key concepts. A. T-test compares means between two groups. B. ANOVA compares means across multiple groups. And D. Chi-square test assesses associations between categorical variables, not the strength of a relationship. Question 5. In a study comparing cholesterol levels between two groups, a t-test yields a p-value of 0.04. What conclusion can be drawn? A. The difference in cholesterol levels is not significant. B. The difference is significant at the 0.05 level. C. The groups have identical cholesterol levels. D. The p-value indicates a 4% error rate. Correct answer is B. The difference is significant at the 0.05 level. Because as explained in the video's hands-on demo, a p-value of 0.04, below 0.05, indicates statistical significance, meaning the difference in cholesterol levels between groups is unlikely due to chance. Option A is incorrect as the result is significant, C is wrong as significance implies a difference, and D misinterprets the p-value.
Hope you enjoyed this quiz. For more exciting and informative videos like this, stay tuned to our channel, and don't forget to hit that subscribe button.